Welcome to Module 8, Environmental Health and Safety. Introduction to Environmental Health. Environmental health is a vital field of public health that examines how the environment influences human health and quality of life. It encompasses physical, chemical, biological, social, and psychological factors in the environment that affect individuals and communities. This module explores the ways environmental factors contribute to disease, injury, and disability, and how controlling these factors can promote well-being. The environment includes the air we breathe, the water we drink, the soil that supports food production, and the built environment like homes, workplaces, and communities. Human activities, such as industrial processes, agriculture, urbanization, and waste disposal, have profound impacts on environmental quality and, consequently, health. Importance of environmental health. Environmental health is essential for preventing disease and improving quality of life. Poor environmental conditions are linked to infectious diseases, chronic illnesses, and injuries. Addressing environmental health challenges reduces healthcare costs and enhances productivity, social stability, and sustainable development. Major environmental health issues. Air pollution. Air pollution consists of harmful substances released into the atmosphere from sources like factories, vehicles, burning fossil fuels, and biomass. Pollutants include particulate matter, PM, nitrogen oxides, NOx, sulfur dioxide, SO2, carbon monoxide, CO, and volatile organic compounds, VOCs. Health impacts. Respiratory diseases, e.g., asthma, chronic obstructive pulmonary disease. Cardiovascular diseases. Increased risk of lung cancer. Adverse pregnancy outcomes. Control measures. Emission regulations. Promoting clean energy and transportation. Public awareness campaigns on reducing indoor air pollution, e.g., cooking smoke.
Water quality and sanitation. Access to safe drinking water and proper sanitation is fundamental to health. Contaminated water sources can harbor pathogens causing diseases such as cholera, typhoid, dysentery, and hepatitis A. Common contaminants: microbial agents, bacteria, viruses, protozoa. Chemical pollutants are lead, arsenic, pesticides. Interventions: water treatment and filtration, promoting hand washing and hygiene, infrastructure development for sanitation. Waste management, proper disposal and treatment of solid and hazardous waste are critical to prevent environmental contamination and human exposure. Types of waste: household waste, industrial waste, biomedical waste, electronic waste.
Risks from poor waste management. Spread of infectious diseases. Soil and water contamination. Air pollution from burning waste. Best practices. Recycling and waste reduction. Safe disposal of hazardous materials. Community cleanup initiatives.
Chemical and toxic exposures. Chemical hazards include pesticides, heavy metals like lead and mercury, industrial chemicals and pollutants, sources of exposure, occupational settings, factories, agriculture, contaminated food and water, household products, health effects, acute poisoning, chronic diseases such as cancer, neurological disorders, reproductive issues, prevention, regulations on chemical use, personal protective equipment, PPE in workplaces, public education on safe handling and disposal. Vector-borne diseases and control vectors such as mosquitoes, ticks, and flies transmit diseases like malaria, dengue fever, Lyme disease, and sleeping sickness. Vector control strategies: environmental management, eliminating breeding sites; chemical control, insecticides, repellents; biological control, predatory species; community participation in sanitation, environmental health policies and regulations. Governments enact environmental health policies and laws to safeguard public health by regulating pollution, waste disposal, occupational safety, and product safety. Key policies include Clean Air Acts, water quality standards, and drinking water. Regulations, Occupational Safety and Health Administration, OSHA, standards. Hazardous waste management regulations. Effective enforcement and community involvement are critical to the success of these policies. Role of public health professionals in environmental health. Public health practitioners are frontline defenders of environmental health by conducting environmental risk assessments and surveillance, educating the public on environmental hazards and protective behaviors, advocating for stronger policies and enforcement, collaborating with environmental agencies and sectors responding to environmental emergencies, chemical spills, natural disasters, workplace safety, and occupational health. Occupational health ensures that workplaces provide safe environments free from hazards that can cause injury or illness. It involves hazard identification and risk assessment, implementation of safety protocols and PPE usage, health surveillance of workers, training and education on workplace safety, promoting mental health and ergonomics. Work-related diseases include respiratory conditions, musculoskeletal disorders, noise-induced hearing loss, and chemical poisoning. Emerging environmental health challenges. New and evolving challenges demand adaptive strategies, such as climate change, impacting vector patterns, air quality, and extreme weather-related health risks, urbanization, increasing pollution, overcrowding, and sanitation issues. New chemicals and technologies. Emerging contaminants require updated risk assessments and regulations. Waste from electronic devices and pharmaceuticals, creating novel disposal problems. This module underscores the essential role of environmental health in public health practice. Understanding environmental hazards, policies, and prevention strategies equips public health professionals to protect populations from environmental risks, promote safety in workplaces, and address future challenges. That will be it for this course. Congratulations on your completion of the course.